Today we are going to study auscultation of respiratory system, and under this topic the first point is air entry. So try to see whether air entry is equal on both sides or not. If air entry is diminished, definitely the person is suffering from pleurisy, and mostly in case of wet pleurisy or in case of pleural effusion, the air entry is diminished, the chest can become absolutely silent. So after that, the second type of sound is to study normal breathing sounds, that is vesicular sounds and bronchial sounds. One should be able to know the difference between vesicular and bronchial sound. In vesicular sound, inspiration is always of longer duration as compared with expiration, while in bronchial sounds, inspiration and expiration both are having equal duration. The second point is that there is no pause in vesicular sound between inspiration and expiration, but in case of bronchial sound, there is a pause between inspiration and expiration. These vesicular sounds are always soft, low-pitched sound as compared with bronchial sound, which are high-pitched sounds. And these vesicular sounds are usually heard all over lung parenchyma, while these bronchial sounds are heard at trachea, at suprasternal notch, as well as in interscapular space at the region of T3 and T4 levels. So this first vesicular sound, if you do auscultation, it appears like this. If you are doing auscultation, the bronchial sounds appears like this. With the study of this normal bronchial and vesicular sound, we will try to study abnormal sounds. And in the abnormal respiratory sound, first topic is abnormal bronchial sounds. First abnormal bronchial sound is tubular type of breathing, or also called as tubular type of sound. So this sound is present over pneumonatic consolidation as shown in the diagram. So this tubular sound is always high pitched sound than normal bronchial sound, and on auscultation it appears like this. The second type of abnormal sound is cavernous type of breathing or sound, and it is present over tubercular cavity as shown in the diagram. So this tubercular cavity, this sound is present, and it is little bit low pitched sound as compared with bronchial sounds, and on auscultation this sound appears like this. The third type of abnormal bronchial sound, that is amphoric type of sound, and this amphoric type of sound is present as shown in the diagram on the open type of pneumothorax as well as on tubercular cavity, and this is a little bit high pitched sound, and on auscultation this sound appears like this. So after study of these abnormal bronchial sounds, we will try to study adventitious sounds. So adventitious sounds are classified in two ways, in two parts. That is, first is continuous or dry sound, and the second part is interrupted or moist sound. In continuous or dry sound, the first sound you have to study is straight out. The second sound is rhoncus, which is also called as wheeze, and the third sound you have to study is pleural friction or rub. Under interrupted and moist sounds, you have to study coarse crepitations, which is also called as rails or also called as crackles, and fine crepitations. To study these sounds, we are going to take help of this diagram. So first we will try to study straight out. So this straight out are caused because of obstruction of big air passage like larynx or trachea. So this obstruction is caused mostly because of the foreign bodies, and it is seen in children. So this sound is very high pitch and whistling sound. Even stethoscope is not required to listen this sound. As soon as the person enters in our clinic, you can listen these sounds. That is stridor, which is inspiratory and expiratory. Both types are seen. On auscultation, the stridor appears like this. The second type of sound is crepitations. To study these crepitations, one should know that these alveoli are get filled with inflammatory fluid, and air try to come inside the alveoli, and air pressure get increases at this region, and suddenly alveoli get open because of this increased pressure of air, and it causes sound. That's why this sound appears only during inspiration. So these fine crepitations heard only during inspirations, and you can see present on over pneumothorax and on over emphysema. So these are fine crepitations, and on auscultations, these fine crepitations are heard like this. Next is coarse crepitations. Coarse crepitations, they are present, they are in inspiration as well as expiration. So what happens? The inflammatory secretions are present in air passages, and air will try to move to and fro from these inflammatory secretions, and it creates bubbling sound, and these sounds is called as coarse crepitations. And these coarse crepitations are present in COPD, chronic obstructive pulmonary diseases. They are present in pulmonary edema. They are present in pneumonia. They are also present in chronic bronchitis. Coarse crepitations on auscultations are heard like this. The next adventitious sound is rhonchi. Rhonchi is also called as wheezing, and this air passage get edematous because of inflammation, and this edematous air passage, the passage becomes narrow, and air will try to move from these narrow passages, and it creates a whistling sound. These sounds are always low pitch and present in asthma. This on examination, on auscultation, these sounds appears like this. Rhonchi are usually present during expiration. And last, pleural rub or friction. This type of sound is present in case of pleurisy, dry pleurisy, and these sounds on auscultation, it appears like this. So this is a discussion about different air sounds, and I hope you will take help of this preparation, and you will diagnose your patient properly, and you will treat your patients properly. Thank you.